Good evening, friends. I'm Dr. Asit Khanna. I'm a senior interventional cardiologist at Yashoda Hospital, Kaushambi, Ghaziabad. And today I'm talking to you about a rare topic or a topic which is frequently overlooked, and that is peripheral artery disease. That is blockages in your arms and leg arteries, which are as bad as blockages in your heart. Cardiologists and peripheral interventionalists are two people who treat these blockages in the peripheral arteries of the hands or the legs, or even in the kidneys or in the stomach or in the neck, which is called the carotid arteries. These arteries are also treated in the same manner as the other arteries, like arteries of the brain or the heart, by giving you medicines which are blood thinners, and then going for further treatments like angiography and angioplasty. Like coronary angiography is there for heart arteries, there is peripheral angiography for arteries of the legs and arms. There are several causes of blockages happening in your arms and legs. How they will present to you, how they are treated is slightly different from that of the arteries in your heart. Just like arteries in the heart are blocked by hypertension, diabetes, cholesterol, lack of exercise, obesity, and genetic factors, the same processes occur in the legs and arms also. We give the same medications in the legs and arms blockages also, that is blood thinners, cholesterol, control the BP, control the sugar, exercise, reduce your weight, and etc. But once it is done, we in Yashoda Hospital, if the blockages still persists, or if the patient has, say, pain on walking for a certain distance, which is called as claudication, we go into the artery by angiography, which is called peripheral angiography, and we put in a stent at the place of blockages in the arms or the legs or the neck vessels. And if they are not treatable by stents, then there's something called drug-eluting balloons. That is, they are just balloons which we go there at the site of the blockage. We inflate it for a few minutes, let the medicine which is coated on the balloon induce into the or leach into the endothelium of the arteries. And then if this is also not possible or does not work, then we have the peripheral bypass procedures, which are done by the cardiac surgeon or the peripheral surgeons. There is now an upcoming field in which a combined hybrid approach is done, where a cardiac interventionalist and a cardiac surgeon combine together, make a team to put a stent or a stents in those places where a stent can be placed, and at the same time we give an incision and open the artery at that places in which the stent placement is not possible, or as I had said, the drug-eluting balloons are not possible, and then they bypass that diseased artery, which is called the bypass. The procedure for bypass in this case is also very similar to the coronary artery bypass procedure that you know as CABG or bypass surgery of the heart. Here, the arteries of the legs are bypassed by the surgeon, while those arteries which are less diseased or small areas are blocked, they are stented, or intravascular stent or stent graft are placed by the cardiac interventionist. So if you have a person in your family who has pain while walking in the calf or the leg muscles, or while using the hands, or is repeatedly fainting, he may be having some blockages in that limb itself and not just the whole body. He should get an ultrasound Doppler of that artery, of that limb, say the left hand or the right hand, go for an angiography of that hand or that leg, and then further treat it with medicines, angioplasty, and bypass also. So it's a comprehensive multi-team approach to treat peripheral artery diseases also. Thank you so much.